context around this. Danny Mortimer is with me, Chief Executive of NHS Employers. Thanks for coming in, Danny.
Thank you.
Just a quick reminder to viewers, your responsibility as NHS Employers are what?
So we represent the employing organisations in the English NHS.
Right. So what do these figures today represent for you? Reality, hard reality, at a time when demand is rising?
And I think that's the key, Hugh. They absolutely reflect the fact that demand for healthcare is rising. In the same report, you see a really marked increase in attendances at A&E in the spring rather than the winter. We see far more patients waiting for treatment than we'd like. And that means our demand for clinical staff, particularly nursing staff, continues to grow. And we're struggling to keep pace, and we've struggled for a number of years now to keep pace with that growth. And it's not that we or the government are being passive in terms of responding to that. We've seen a significant investment in starting salaries for nurses, for example, and we'll see those increase quite dramatically over the next few years. We've seen really important changes to the way in which we manage migration as a country. We expect that to help us recruit more nurses and doctors, but it takes a long time to get those extra people into post. And in the meantime, our staff are working really hard, really hard to keep pace with the demand. What I would say in terms of those vacancies is that for nurses, we do fill 80% of those gaps. You know, those shifts are filled by bank or agency staff 80% of the time, but that still puts pressure on our existing teams, which, you know, we're desperate to do something about. And the investment that the Prime Minister has announced this year goes some way, we hope, to helping alleviate that pressure. But again, it's a long, hard road to make the best use of that investment.
Do you think it's, you know, is your take that the words national emergency are fair words to use or not?
I think if we weren't trying to do something about it, I think they would be a fair characterisation. As I've said, we've seen action this year on pay and migration. We're hopeful that steps will be taken on some other things as well that would help us. We'd like some flexibility to do more with apprenticeships. We'd like some better investment in some of our funding for continuing professional development. But in terms of actually articulating the fact that this is a problem for us, that this is putting real pressure and real stress on our teams, particularly in services like mental health, then yes, we absolutely recognise that. And as employers, we want to work alongside government and the national leadership of the NHS to do something about it.
You mentioned migration a few times, and I'm bound to ask a question rather directly, because of course it's come up time and again in recent years, with indeed people sitting in that seat saying, well, I'm less attracted these days. If I've been trained abroad, I'm from a different country, I'm less attracted to a career in the NHS because I think something's changed in the last few years. Do you think that the changes more recently introduced by government have gone some way to alleviating that or not?
I think they've gone some way to doing that. You know, we were facing an acute problem at the beginning of this year, and the government did take action this summer, and that has changed the way in which we can recruit doctors and nurses from outside the EU. And we take some real encouragement from that for what we need to do post-Brexit. You know, if this is an indicator of how the government are going to manage migration after we leave the European Union, then I think it's a very positive step. But clearly, and you've reported it, since we voted to leave the European Union, our supply of nurses in particular from within Europe has effectively dried up.
And you see no sign of that having changed significantly in the interim?
No.
Okay, Danny, good to talk to you. Thank you for coming in.
Thank you.
Thanks very much. Danny Mortimer, the Chief Executive of NHS Employers.